At the beginning of this year, when we first began the process of our annual State of the School address, the world looked very different. And as we began to face the harsh realities of COVID-19, it became abundantly clear to us that the state of Morehouse School of Medicine and Georgia, and actually the nation and the world, were going to change drastically. Morehouse School of Medicine, like many institutions and organizations, has been challenged by this global pandemic. Our bright, promising students swiftly transitioned to a virtual academic environment. Many of our time-honored traditions and events were either canceled or modified to adhere to social distancing guidelines and local and federal ordinances. We swiftly implemented our business continuity plan and unfortunately had to reduce much of our research and clinical activity that was not centered around COVID-19. The past 2 months have had its challenges, but I remain encouraged by our faculty, our staff, and of course our students. Our students at Morehouse School of Medicine, our residents at Morehouse School of Medicine, those young, bright minds who really excite us to want to come back. So even in these unprecedented times, their dedication and our faculty's dedication and our staff dedication to the values we hold dear allow us to continue our mission, unwavering. As we see the many ways this pandemic has affected communities and families across the globe, especially in vulnerable and underserved populations, we know that the mission and vision of Morehouse School of Medicine is needed now more than ever. Our resolve is strong, and we are committed to serving as a catalyst for health equity. I hope you enjoyed this address, but more importantly, I look forward to partnering with you as we heal our nation and advance health equity across the globe. Thank you.
Welcome to the Morehouse School of Medicine State of the School Address, presented by President and Dean, Dr. Valerie Montgomery Rice.
Since our founding 45 years ago, Morehouse School of Medicine has been more than an academic institution and research enterprise. We have been a pillar in the communities we serve, and we've been a catalyst for culturally competent, innovative medicine as we have worked to transform medical education, patient care, research leading to scientific discovery. Recognized for our social mission, Morehouse School of Medicine continues to recruit, educate, and train future healthcare leaders poised to serve vulnerable and underserved populations. But most importantly, we prepare healthcare leaders to understand what is truly required to advance health equity. You see, for us at Morehouse School of Medicine, health equity is about giving people what they need, when they need it, in the amount they need to reach their optimal level of health. This requires us to transcend the traditional role of an academic health center and to work directly alongside the communities we serve, addressing the challenges and the issues they face, not from a place of authority though, but as a trusted partner, ready and willing to roll up our sleeves and do the work, not for them, but with them. It requires us to be an agent of change in those communities, serving as a catalyst for a brighter, more equitable future. Our greatest opportunity to be a catalyst for equity is with the people we educate and train to practice medicine, public health, and research. As we consider that in the 2017-2018 academic year, only 572 Black men matriculated to medical school out of 21,338 entrant students. And if you look at that 572, only 257 of those men were born in the United States. That forces us to ask some tough questions about these numbers. What is it that we can be a catalyst for that will lead to changes required to alter this outcome. Our first catalyst starts with our pipeline program, increasing the number of persons that flow through our educational system. Morehouse School of Medicine is a leader in educating and training minority health professionals. So we are able to find those diamonds in the rough. This is something that we're very proud of. We look for students who have demonstrated grit and resilience and dedication to service, dedication to communities. And we look for those characteristics because we know they sometimes speak louder than standardized tests. So we've been a catalyst for a holistic admission process. And we continue to drive the narrative around the importance of those who we educate and train. We proudly boast that greater than 60% of our graduates practice primary care and serve in underserved areas. We boast that our researchers are focused on diseases that disproportionately impact our communities. We boast that our new PA program is recruiting students who are going to go back and practice in those underserved communities. 572 Black males out of 20,000 students. Do we understand what that does in the classroom setting when we're trying to tackle issues that impact our community like gun violence, the opioid crisis? We understand the importance of having the diversity in the room because that's where our students learn the most. That is how they learn best to care about the communities that are affected by these problems. We know, though it doesn't just end in the classroom, it actually has to extend to the communities around us. The crisis we are facing with the number of Black men in medicine and truly the diversity challenge overall reflects a very leaking pipeline. We know that our STEM programs, our STEM education is a direct response to fill in those leaks in the pipeline. Our programs that start at kindergarten and extend all the way into the graduate level work for us and work for the community because they were born out of the community. Our partnership with Tuskegee Airmen Global Academy, a K-5 Title I school minutes away from our campus, is a demonstration of the commitment of our faculty, our students, our staff to be mentors and tutors, assisting with STEM education. We're there every day, serving as a catalyst for what's possible. What's most exciting, though, is that we have these kids and their parents on our campus 2 to 3 times a year, making a difference, showing them what's possible in a health career. And so when we do this work, we're doing it in a holistic manner with our partners, making a difference. Many may question, why do we as a medical school engage in these efforts? And my answer would be because we must. Health doesn't start in the lab or at the patient's bedside. It starts in the communities and the very lives we seek to serve. The community was at the forefront of our mind when we launched our West Side Story, which is the development of our Lee Street property, the 7.2 acres of land directly across from our campus. What some may not know, though, that idea didn't start with me. It started 3 presidents ago in conjunction with the other AU Center presidents who had a vision for what we should be doing as anchoring institutions for this West Side community. Our development consists of 25,000 square feet of an ambulatory healthcare center, 1 floor dedicated to our students, the other dedicated to the community, and a Y that is going to be a really cornerstone for health and wellness in the community. And then, of course, we have the over 150 apartments that will be utilized by our students and those in the community who want to see this area grow and blossom. We are excited about both the economic impact and the health benefits that this development will have on the West Side. It's a story we are proud to share. It's our West Side story. To be truly transformative, to make an impact that leads to health equity, we must be both innovative and bold in addressing inequities in health outcomes and care delivery. Many of you have heard the stories of maternal health and mortality and the inequities associated with the fact that African American women die of pregnancy-related causes at a rate 3 to 5 times higher than white women. As an OBGYN, as a mother, as a sister, as an aunt, as a person who's experienced the joy of my own children and delivering those of many, I know that these inequities that we see these women experience can be changed. So we are really excited about our state-of-the-art Center of Excellence for the reduction of maternal mortality and focusing on maternal health that we are developing here at Morehouse School of Medicine. We're going to catalyze a change in how we approach maternal health. And then we're going to get to see the impact on that for families, for communities. We're working with many organizations to talk about how we can see an extension of care beyond the normal 6 weeks for those women who are receiving Medicaid benefits. We're going to talk about what it is that we do to look at the data that we know exists, not just in the unfortunate cases that resulted in death, but those cases where there were near misses, those cases that we were able to manage something right that resulted in a positive outcome. We can learn from that. And yes, we're going to emphasize training on conscious and unconscious bias. We're going to ensure that we are educated and training culturally sensitive providers who listen to all women equally when they complain of things that they know are happening to their body, that are impacting their ability to achieve their optimal level of health. And then finally, we are going to work with the community, because we all know that it takes a village to raise a child, and it takes a village to save the women who are impacted by the challenges with maternal mortality. Morehouse School of Medicine is going to be on the forefront of ensuring the inclusion of minorities in health research, particularly that of precision medicine. Using All of Us studies and 20 by 20 programs, we're ensuring that better data is being provided to inform others who are involved in this research and providing engagement and inclusion of people of color in these important research studies. One example of how we are leveraging our partnerships with ensuring that we democratize the opportunity for data in our communities is through a grant with the United Health Group Foundation. This research partnership allows us to look in 4 southeastern states: Georgia, Kentucky, North Carolina, and Tennessee. It is a grant funded for 3 years to help us to examine how to make digital health technology more accessible and useful for residents of urban and rural underserved communities in these states. We're not just looking at the primary care doctors, we're actually talking to the people who are going to benefit from this opportunity so that we can remove the barriers and allow people to reach their optimal level of health, even if they're not sitting directly in front of their doctor, but using digital technology to make what's possible happen. This would not be possible without our partners throughout the state of Georgia and across the nation. Our partners who range from a spectrum of our legislative leaders to Atlanta Public School System, to our Community Coalition board members, and of course, to our alums, our faculty, our staff, and of course, our students. As we continue to promote healthcare and healthy living, we will challenge ourselves to be both an innovator and catalyst for health equity. Thank you so much for being a partner with Morehouse School of Medicine as we lead the creation and advancement of health equity.
Thank you for listening to the Morehouse School of Medicine State of the School Address. To learn more, visit www.msmimpact.org.